guys, welcome to Made by Doc. On this channel, I'll be talking about health and wellness primarily and blockchain and technology stuff that I'm pretty much interested in. If you don't know me, or if it's the first time that you're visiting this channel, I'm a primary care physician, a medical doctor, a lecturer in primary care medicine, and an entrepreneur in blockchain and smart farming technology. Without further ado, let's get into the topic. This question has been a primary question that's been asked from me by many people. Is the Sinopharm vaccine safe? What is the Sinopharm vaccine? The Sinopharm vaccine is a vaccine developed by a Chinese corporation established many decades ago in China, and they have built a vaccine against the COVID-19 virus. So is it effective? We know that there are many vaccines out there that's been issued by many companies in alliance with many universities. So AstraZeneca has partnered with the Oxford University, and the Moderna vaccine, the Pfizer and the Johnson & Johnson's one, and the Sputnik one from Russia, and the Sinopharm from China. So there's no doubt that people have concerns about the Sinopharm vaccine, provided that it was provided by the same country which the pandemic originated from. So I've decided to go deep into the scientific literature and try to find a solution for this. Sinopharm vaccine is currently given in many countries, primarily in the UAE and many other Asian countries primarily, and again in China as well. So when it comes to the vaccine, what matters the most is its safety profile and its efficacy. How safe is the Sinopharm vaccine? To conduct a safety profile of any medicine, not just vaccines, there are processes called clinical trials. Usually for vaccines there is 3 phases of clinical trials. Sinopharm vaccine have completed the second stage of clinical trials, and according to that, the company claims a 79% efficacy against COVID-19 serious disease and infection, and a higher percentage to avoid complications. First country to adopt the Sinopharm vaccine was the UAE, and there is evidence that the Sinopharm vaccine does a better job than the proclaimed 79%. The UAE figures have gone up significantly, claiming to have 86% efficacy. The side effect profile of the Sinopharm vaccine is quite established. The commonest side effect is headache. You might have body pain, a mild fever, a runny nose, and some upper respiratory tract infections with general discomfort. Severe complications such as anaphylaxis and other conditions are very rare. So it seems to be effective and it seems to be safe. So how about the other vaccines? Other vaccines also have a similar side effect profile, even though the AstraZeneca vaccine have faced bigger scrutiny globally, especially in Germany, where they withheld, and some other countries had some issues, especially about formation of blood clots in the blood vessels. But that's not a formed conclusion yet. So to date, the Sinopharm vaccine is safe, and most importantly, please take your vaccine, because the vaccine manufacturers and the scientists are far behind in schedule to provide adequate vaccines to stop the transmission of the virus globally. This is not a concern that will only affect one country or one territory. When normal economy begins, people will start moving around and they might carry the virus again. And more importantly, unless we vaccinate most of the population fast, the virus is going to jump from one person to another and mutate itself to form another variety that will be resistant to the vaccines. So if this was your question that stopped you from getting the vaccine, I hope I've clarified your doubt. So don't delay your vaccine, and please make sure you get it as soon as possible from your authorities. And if you have any side effects, please make sure that you contact your family physician. And also, if you're further interested to read about this, I have an article on this topic on healthreviewglobal.com. You can check. I've inserted the link in the description below. You can follow me on TikTok and also Instagram and on Health Review Global primarily. Thank you, and I wish you all the best.